Are you someone who is currently trading your time and energy for a paycheck and feeling burned out in the process? Well, keep listening as we talk with one of our favorite money savvy physicians who's choosing ownership through direct primary care. Hello, and welcome to the Wealth Minded MD podcast with your money best friends. I'm Dr. Leisha Taylor.
And I'm Dr. Brittany Halford.
And of course, we're here to help you build wealth and make good money decisions so you can create the life you desire with more control over your time. If you've been looking for a financial planner who truly gets you, let me tell you about Bonafide Finance. Ben and his team at Bonafide Finance are like the primary care physicians for your finances. They take the time to understand your goals, meet with you regularly for financial checkups, and build real trust and rapport so your plan grows and adapts as your life changes.
What really sets Ben apart is his expertise. He understands student loans for high income earners, something most planners overlook. And he's a tax strategist, helping you invest your money in the most tax efficient way possible. And the best part, Bonafide Finance operates on a flat fee model. So you always know exactly what you're paying. No commissions, no hidden costs, just honest financial guidance.
Ben's approach isn't just about making your money grow, it's about making sure your wealth aligns with your life. So if you're looking for someone who can manage your investments, grow your wealth, file your taxes, and help you with your student loans, there's only one choice: Bonafide Finance.
Book a consultation at bonafidefinance.com/wealthmindedmd or email hello@bonafidefinance.com and tell them we sent you. All right, Leisha, tell me what is going on in your life.
Well, I have created this new hobby of creating different mocktails. So I'm someone who loves wine, but am actively trying to cut back and just drink less. This was sort of preempted by my dry January journey, which I do every year. Also by the fact that I have so many friends who are pregnant. Like, there is something in the water, honey. I am like, oh my goodness, either they're pregnant, popping out the baby, or trying to become pregnant. It's like a whole gamut. And because of that, different friends in my life who we used to have wine nights, they're like, I'm not drinking. And so during my dry January month, I was actually like, okay, let me see if I can get good at different mocktails so that when people come to my home, they have other alternatives to drink besides alcohol. It's just like there's an alcoholic option for you to drink if you so choose, and there's a non-alcoholic version. And so I started ordering these different fruit purees and making purees, and I got the club sodas and the ginger beers, which is non-alcoholic, even got non-alcoholic wines and proseccos and different mix-ins. And so that's spending my time on Friday nights. I'm like, ooh, let me try a little vanilla here, a little passion fruit here, and they are great. I'm enjoying myself, and my friends love it because now, if they don't want to drink, they don't have to drink, and they don't have to necessarily tell me why they don't want to drink. So that's what I've been doing with my girlfriends. We've been having mocktail parties.
So basically, you telling us that you becoming a full-time bartender. You about to give up your position role and go work at a bar somewhere. That's awesome. And I think it's really interesting as you're talking about this. I'm like, oh, what if there was a bar that only specialized in mocktails? You know how everyone can craft out their niche and really create this unique experience. So that would be my kind of bar, is to go and nobody has alcohol, but everybody is enjoying themselves. Anywho, so I love that for you. I love that you're supporting your friends, and also that you are finding new ways to have your own drink, maybe without the actual alcohol in it. So that's amazing. All right. Well, as we're talking about transitioning, trying new things, we had a fantastic conversation with Dr. Disha Spath, who is doing just that. And what I really loved about our conversation is that there was a lot of transparency, vulnerability, reflection, even as we were discussing, courage, inspiration, but just honoring thyself. And I think too often as women physicians, we are so accustomed to just sacrificing for academia or sacrificing for our patients, not acknowledging the burden that it places on us. And there is a study that showed that longevity of women physicians is actually a lot lower because of the work, because of the toll that we have as caregivers in our careers and then caregivers in our lives. And so this conversation with Disha really honors that commitment of true to self and acknowledging that when your cup is full, you can overflow onto someone else. Of course, we talked about money too. Yeah. But for me, I think that was kind of the biggest takeaway is just how we can be true to ourselves and still do good work in the roles that we have.
Yeah, I wholeheartedly agree. I can't wait for you all to take a listen. All right. And for our financial focus today, or should I call it wealthy insights? I don't know. But basically, we're very excited to have one of our friends back on the podcast, Dr. Disha Spath. Her and I met, I think, a few years ago because she was very intimate in the podcast world, doing podcasts and helping other physicians, especially females with money. And she's done a lot of amazing things. But we have you back today because something else amazing that you're doing, which is branching even more into the world of entrepreneurship. And so thank you for joining us on the podcast. We are very, very excited to have you.
It's my honor to be back here. I love you, ladies. I just love what you're doing. And I love getting on the podcast or any kind of chat with you guys because you're so inspiring. So thank you for what you do.
Well, thank you. Thank you. I know that you've got a lot of things going on, and I think we should just maybe dive right into what you're doing and what your next adventure might be. And so I know that you have helped a lot of doctors with money for years. What was kind of the moment that you realized, hey, I think I want to build something different and maybe transition into something slightly different in your own clinical career?
Yeah, so I got into financial wherewithal, learning about personal finance really because I was burned out. I was a burned out doctor and I was working too hard and making too little, and felt like I was tied to my job and tied to my debt. So I decided to pay it off. And that's how I started on my personal finance journey. I started writing about it. It took a life of its own and it kind of grew on its own, which is like so fun and exciting. And so I rode that wave for a while. Recently, like last year, I signed up for the Certified Financial Planner course. I really wanted to do it just to learn the book knowledge that I have for medicine in the finance world as well and get that certification. So I was working on that. And then I realized I was like, oh, this is interesting. This is fun. This is kind of like internal medicine where, it's very like diagnostic, very detail focused. And I'm going through and like dissecting people's financial lives and coming up with a plan and all that stuff. It was fun. But around that time, I also had a surgery. I had a hysterectomy and I was convalescing after that. Like for a month, I was supposed to be taking it easy. And after the surgery, as I'm sitting on my couch, unable to get up and like losing my mind, I was thinking about what is my life's purpose. Having been through this surgery that had endometriosis that was like missed for like 8 years for so long and finally had a doctor who would listen and did the right testing and found it and helped me get over it. I really just realized sitting on that couch that I had the incredible opportunity to be that person for some other people. I, as a doctor, can do that for other people. It is such a huge honor. And to think about even walking away from that, when I asked myself, what is my purpose in life? I came up with the answer that my purpose is to be a good doctor that's there for people and listens to them. Despite all of it, despite all the years I spent trying to get financially independent, kind of getting away from medicine mentally, from the ties of medicine anyway, and like looking at other things, despite all of that, and that juncture, when I asked myself, what do I want to be for the rest of my life? It was still, I want to be a primary care doctor. That's what I want to be. That's who I am. Like, that's my calling. And it's a huge honor to be able to do that now. I now have like 10 years of experience. Now I'm, a better doctor than I was when I started anyway, right? Because I've been seeing things and I've experienced healthcare from the patient's perspective, both in my life and for my husband's life. And being the caregiver, it was a turning point for me. So like, you know what? I'm not going to finish my CFP, actually. I'm going to start a direct primary care clinic because that's what I've always wanted to do. I want to do primary care, but I can't do it in the insurance world. It's torture and abuse. To be perfectly honest, that's how it felt in the insurance world. But I know that I want to be a primary care doctor. I know people need a primary care doctor. So like, let's make this happen. Let's work it out.
I'm happy that you had such an amazing physician who listened to you and was able to provide the care that you needed. I love that that moment of pause gave you clarity and it helped you to really define what is needed now I also appreciate the courage of transitioning again, for me specifically. When I was 7, I knew I wanted to be a doctor, right? And so when we now have different interests, sometimes it's difficult to pursue those because we kind of put ourselves in this box of this is what I'm supposed to be. I've been doing this for all these years. I just need to continue to do this. This is what I know. This is who I am. But you have given yourself permission to evolve and to embrace and to just really become who you are in that phase. So I have a question with this transition. Did you have any kind of fears or mindset shifts that were required for you to be completely grounded and confident in pursuing direct primary care?
Well, thank you so much for summarizing what I was trying to say in a much more eloquent fashion. And that's exactly what I meant. So, yeah, fears, absolutely, right? I used to run a platform called The Frugal Physician, and scarcity mindset is like home for me. And I really have to work at getting out of scarcity and getting into the growth mindset. I said that was a year ago, right? Actually, it was 2 years ago now that I had that epiphany. But then I started like changing the way I'm working. So I went per diem at 2 different hospitals only and it started working a lot to try to save money. And my mindset was, oh, I need to have a 6-month emergency fund plus the money I need to start my clinic. Plus, I need to have at least 6 months of living expenses, on top or whatever that I can draw down from. I had rental property, so I need to have a good, solid emergency fund if anything goes wrong. So anyway, I just got into this super scarcity, like I need to save so that I can launch this DPC and be prepared not to have income for a few months as I started up and to be investing in the practice, right? And pouring money into actually getting it started up. So I probably tried to push myself to save too much. And that was a mental hurdle I needed to get over. The way I got over it, I mean, I definitely gave myself goals. I gave myself probably a little bit too much time to get prepared. I probably should have just done it last year. But I did set a goal start date and I'm almost there. I'm almost making the start date. So I'm okay with that. Just setting a goal start date and be like, this is when we're going to do it. And we're just going to plan our life to make it happen then. It's going on the calendar. That's how I got over that scarcity.
Well, I want to commend you again for taking this leap because I think for some people listening to this, they might be thinking about or wanting to take a leap in their own lives. Maybe it's the same leap that you took into direct primary care, but maybe it's something else, right? Maybe they're a doctor listening going, I think my life's purpose might not be practicing medicine. I think my life's purpose might be X, Y, or Z. Wow. Look at Disha, who really pivoted, right? And gave herself the permission to change her mind and to think about what she really wanted to do. So I want to commend you for that because I think it's hard sometimes to make that decision, whether you make a lot or a little bit. I know some people who maybe don't make high incomes and are like, I can't afford to pivot. And then I know some other people who make very high incomes that are like, do you know how much I make as a doctor? There is no way that I could pivot. So I really want to commend you for doing that. Thank you for being very transparent about the fact that you were like, hey, I got to save in order to put myself in a position to be able to do this. And I know that you just said that, hey, maybe I erred on the side of caution a little too much and delayed my dream a little too long. And so I think there is this sweet spot for some people about, yes, I want to take the leap. I need the courage to take the leap. How much is enough to be financially stable and to feel comfortable taking the leaps? I think those are some questions that people might be wrestling with. But for those who are thinking about DPC, they're hearing you talk about it and they're like, hey, this is jazzing me up, okay? Because I'm tired of insurance too. I'm burned out too. I'm overworked too. So can you explain in simple terms to anyone new to direct primary care or DPC what it is in simple terms and why it appealed to you?
Okay. So in the insurance-based world, we function on a per visit basis, right? We're kind of like Blockbuster before Netflix. You rent out a movie, you come to the doctor, you make a visit, right? You pay the copay, then the insurance gets billed, you pay that bill 3 months later, that comes to you, that got applied to your deductible or whatever, and you use it in a piecemeal fashion. DPC for primary care is like Netflix for the movies world. When first Netflix was thought of, they proposed charging only $9 a month, right? Is where they started at. $9 a month for unlimited movies. No late fees, no ancillary charges, just $9 a month. You watch it as much as you want. People thought they were nuts. Blockbuster, people were like, How are you going to make money? But the Netflix people believed in their model. Why? Because, you're not sitting all day watching your Netflix. When you sit down to watch a movie, you want to watch the movie you want to watch, right? But most of your day is spent doing other things. So not all their subscribers are using Netflix 24/7. And that's their model, is that if you make it affordable enough, you'll have enough people that want to join that don't use you all the time, but when they need you, you are there. So that's the DPC model. You're not charging per visit. You're not going through insurance. You're paying a low monthly fee, $100 a month. We're not concierge. You don't need a private jet, and you don't need $1,000, $2,000, $3,000 a month. You don't need to pay that in order to access your doctor. You're paying $100 a month. And for that, you get unlimited visits as much as you want. The business model is based off of the fact that most of the time, people are not going to be using their doctor 24/7. At some point, they're going to run out of things to come to the doctor for. But what you have with that is, number one, convenience for the patient. They can get in with you now, because instead of having a panel of 2,000 patients like most primary care doctors, now you have to only have 250 patients to keep the doors open and 500 patients to make a very good primary care doctor salary and pay the overhead. 500 patients instead of 2,000, so you can get them in when they are sick. You can get them in same day, next day. I have a DPC doc, so I realized I have to have an ACL repair because I took up skiing as an adult, and it's a very stupid thing to do. Sorry if you ski. In my case, I am like so not a skier. I tried very hard. Anyway, I fell and I broke my ACL, or tore my ACL, so I need to have it repair. That came at me yesterday. The orthopedic doctor wants to get me in for surgery this Friday. So I called my DPC doctor. He's like, yeah, no problem. I've got 2:30 this afternoon or 9 a.m. tomorrow for your pre-op clearance. What would you like? They needed the pre-op clearance before this Friday surgery. He was able to get me in this morning. I just came from there for my pre-op appointment. And this was literally yesterday that I texted him. And that's the difference with DPC. Like in an insurance-based world, if I had tried to call my primary care doctor for a pre-op clearance for same week pre-op clearance, I know from the doctor perspective, that's near impossible to do, right? To try to fit people in when you're already completely booked. And I would probably have put someone out and it made them miss lunch or dinner with their family in order to get me in. But instead of all of that, I have a doctor who knows he can keep his doors open. I pay him a low monthly fee. I go see him. I spent an hour with him. We talked about a bunch of different things. He did my pre-op, and he's going to take care of me as I get my surgery done. That's the difference with DPC, is that you have availability. Patient has the convenience also of, like, you don't have to make them come in if they don't need to come in. You can do telemedicine. You're no longer billing insurance. So you don't have all the billing rules of insurance. So you can provide care the way the patient wants to have care. And because it's only 500 patients, you don't need a front desk staff. You don't need a nurse necessarily. So you can directly talk to your patients and give them what they need and really make them feel heard and taken care of on a daily basis. So that's the sell of DPC, is that you have enough time to take really good care of the patient that you have. And the low monthly fee, when multiplied by 500 patients, is a good bit of money. It's about $600,000, right? That you're making a year. And then, you can use that to pay yourself and cover your overhead.
Well, Disha, one of the things that I want to say is sorry that you tore your ACL. I'm appreciating the courage to take up skiing as an adult, because I have not been skiing yet. Because of this reason, I always hear people injured from skiing.
It's true.
And so it's one of the things that I put on my list every year. I need to just take my kids so that they can learn and be closer to the the ground. So therefore have hopefully fewer injuries as an adult. But aside from that, I want to just acknowledge what you're saying here, is that one of the attractions to this direct primary care route is not just for yourself, but also for your patients.
Yes.
I think that many patients, I hear the complaints all the time, because then I'm like, well, y'all don't understand how it is to be a doctor, right? They're like, oh, my doctor never touches me. She's in and out. She doesn't look at me. She's always charting. She's doing the things. And what you're saying is, yeah, that's one way of operating, but here's another way to provide care. Here's another way to provide care in the way that the patients really desire it. And I commend you for having the courage to align that desire to provide excellence and exceptional care in a way that patients can feel as if they're in the center of their care, and also accomplish your life's purpose and provide additional wellness to yourself and to your family. So I think that that is tremendous. And I also appreciate the analogy of Blockbuster to Netflix and how everybody had their opinions of how it will not work. And so I wonder, taking that frame, what were some of the opinions that maybe you've heard from colleagues, et cetera, about you transitioning, and how did you navigate that?
Yeah. So, now thankfully the DPC model is pretty well known in the doctor circles. It's not that well known in the patient circles, especially where I am right now in New York. And DPC has not made as big of a splash here as the rest of the country, like Colorado or the South. Because of our laws, New York State was wanting to treat DPC like insurance. And now that the DPC legislation has gone through in the OBB bill that was just passed and went into effect, it has basically taken the technicality that DPC might be treated like insurance off the table. And so now it makes it much more possible in New York. Anyway, so the naysayers in New York were the people that were like, oh gosh, you might be treated like an insurance and then regulated like an insurance company, which is not good. So now that it's perfectly copacetic and legal and like there's not that gray area anymore, it's making the naysayers a little less loud. Patients are like, why? What's the value add? Why would I spend out of pocket when I can use my insurance? For people that actually count how much money they are paying to the insurance, they can easily see that between the co-pays and all the stuff that goes to deductible and the co-insurance and all the other out-of-pocket expenses, if you use your doctor at all, you're going to end up paying more out of pocket than you do for your DPC fee easily, right? If you go to urgent care once, it's like a $300, $500, $600 bill, right? That goes directly to your deductible. But for $1,200 total for the year, you have unlimited care. So you can go to the doctor not just once, but, like multiple times, and have the convenience of having a concierge type doctor available to you. And the peace of mind knowing that I can just text my doctor, hey, I feel like I'm developing a UTI, I can text my doctor and he'll just order the UA and I'll have treatment right away. And like, who gets that kind of care these days other than billionaires, people that belong to DPCs, right? And these are regular old people, working class people that are just going to get good care. So I hear from my doctor friends, of course, they're very interested. Everyone like, oh, really? Oh, you're going to do this. Okay. So like they want to join. There's so many people that I talk to that want to come join me. And I'm like, God, I don't have money right now to hire you. Otherwise I would, like come on over like soon. So I'm like making plans, like how can I bring more people on? There's so many doctors that want to provide this kind of care, but they don't want to do the whole business side of things. So they'd rather join another DPC. And that's great. So there's a lot of interest there. But as far as naysayers go, the biggest naysaying is, well, now you're going to be able to help less patients. Now you are creating a two-tier medical system where the better off get great care and the people that can't afford these fees don't get good care. And yeah, it's true. I can't get around that fact that, yes, it does create a two-tier medical system. However, if we don't do this, if I don't do DPC, I'm not doing primary care. I've tried primary care in 3 different practices now, in 3 different types of ways that I thought might work. And I wanted to give it a shot. I mean, I really wanted to be a primary care doc, but no matter which practice I went to, it was the same problem. Trying to see too many people in too little time. Basically, too much administrative pressure to see more and more and more and more and more and more. Work myself down to the bone. And as much as I love working hard, I am an incredibly masochistic person. I love working hard, but it was too much for me. And I'm okay saying that that's like, life's too short to kill myself for a job that honestly didn't feel like appreciated me all that much. I wasn't happy. My patients weren't happy. Why? Because I couldn't get them in when they were sick. I was overbooked already. And no matter what I did, some people didn't get in. I tried to get in as many as possible, but there are some that couldn't. And it didn't feel good. I was working myself to the bone and didn't feel like it was benefiting enough people, even though I had 2,000 patients in each practice I worked at. So I guess going back to we're creating a two-tier system, Yes, but you're not going to have good PCPs lasting in this one tier system that you have. That people are dropping left and right out of primary care because it's not a good place for a doctor to be. Honestly, not a great place for a patient to be either in insurance-based medicine. So insurance simply does not pay enough for primary care. And honestly, we don't use our insurance for routine home repairs. We don't use our car insurance for routine car repairs. Why do we use our health insurance for routine health care? I mean, of course, the prices are going to be crazy and through the roof for insurance when we're using insurance for routine stuff. So I think it makes sense to take primary care again out of the insurance framework and make it cash-based again, because that's when it worked well.
I mean, Disha, your analogies today have been on point, from Blockbuster to Netflix to car repairs. Yeah, I'm eating it up. I'm like, yeah, that makes sense. Why didn't I think of that? So this is fantastic. I am sure that there are people listening, like I said, that are very intrigued. They're like, oh yeah, I need one of those. I probably should do direct primary care. Doctors thinking maybe I should transition. Patients thinking maybe I should get a DPC doc. You are really working it up, honey. I'm telling you, I'm like very convinced. But transitioning a little bit more on the finance side, I wondered, as someone such as yourself who is starting their own practice, what financial or business mistakes do you see other doctors make when trying to start their own practices or trying to start their own businesses?
Yeah, I don't want to call them mistakes, but there's some people that jump right into DPC. They're so burned out, they simply cannot take it anymore, and they just quit their job and like, screw it, I'm starting my own thing, and they jump right in. That's not necessarily wrong. When you do that, when you jump in with both feet and you give 100% to a new venture, it is bound to do well because of that effort that you're putting in and 100% focus and the fear, right? When you don't have a paycheck and you're going in feet first, wow, okay, talking about analogies, now I'm just totally screwing that one up. Anyway, when you're going in with your 100%, that is a better way to start a business than trying to do half and half, like mentally. I just spoke to one doctor recently who started the practice, but just wasn't prepared for the fact that she wasn't going to make any money for the first few months. It takes a little while to build up a patient panel, to actually get in the black and then start paying yourself a salary. It takes several months. And most people say, give yourself 2 years, you know. Generally, DPC doctors don't take that long to be able to make money, but that is the most conservative estimate. Give yourself 2 years to be able to make the same salary you are now making in the employed position that you were in. And so you need to be prepared for that mentally, you know. They're the people that are not financially prepared going into it. You also need to know, if you have student loans, like, what are you going to do with those student loans when the bill comes due and you're not making any money? So that is a big deal. Having like a per diem gig to support yourself while the practice is getting going makes things a lot smoother for the family that is used to living at a certain monthly income. So that's what I'm doing now. Of course, that makes it so that I cannot take Medicare patients, because if I'm seeing Medicare patients in the hospital, then I can't take it. Then I cannot bill them out of pocket for my practice per the Medicare rules. So I can't take 65 and over while I'm doing per diem. That's not great, but at least that gives me like a little bit of leeway and head start in that I can work on the weekends in the hospital and then work during the week in my practice. And hopefully my family doesn't have to feel the transition financially. So that's one thing, is people just are not prepared for the financial implications of starting your own practice. Other mistakes maybe is that people don't realize how much you need to do social media in order to start DPC. You guys would have a head start on that. You already know how to do it, and you have the systems and the teams to do it. But a lot of people don't realize marketing on social media is like another full-time job if you don't do it intentionally and outsource and things and build systems. So yeah, those are the most griping about.
Oh my goodness. Yeah. Disha, the social media perspective, I think that is the bane of many business owners' existence. So I commend you. And it just really also demonstrates where patients are receiving some of their information, you know, as far as even looking for healthcare information, finding a new doctor. It's how kind of pervasive social media has become in our day-to-day and decision making. And I also appreciate your transparency about how you're making this work while balancing your hospital medicine job and allowing that to help to offset some of the financial burden initially that building this practice involves. So my question is, you know, with all of that to consider, how do you think women physicians would better understand how medicine, money, and ownership kind of interplay as they are considering maybe starting their own practice or maybe transitioning from whatever career they have previously built in medicine? Do you think that medicine would change very much for women physicians? And you could take medicine like in a broad sense of how it impacts our patients or how it impacts physicians and burnout, et cetera.
That's an interesting thing to think about. Like, how is medicine going to change? Because here are the facts. The women make up greater than 50% of our healthcare workforce. By the way, happy belated National Women Physicians Day, which was yesterday.
Yes, same to you.
Yeah, same to you. Same to you.
So amazing. There's so many women physicians now. However, we don't make up an equivalent amount of the C-suite. We don't make up the equivalent amount of the leadership. We also know that we have a significant pay gap when it comes to earning as a woman physician. Just being a woman physician often makes you miss out on average $2 million over your lifespan that a man would be making in the same position with the same credentials. That's a lot of money. So how is that dynamic going to change when women become business owners? It has the potential of really changing generational wealth for women. When we become business owners, now we pay ourselves, hopefully a fair salary, right? But not only that, it's not just about the salary, it's about all the different ancillary benefits of being a business owner, such as, tax write-offs and being able to really tax optimize in a much more efficient fashion than you could as a W-2 employee. Then you're building equity in the business, you're building equity in the real estate that your business is in if you own it. And as a DPC doctor, you have a much better lifestyle. Now, you have 500 patients that pay monthly but don't come see you every day. The average amount of patient that a full-time practicing DPC doctor sees in a day is 6 to 8 patients a day. So 6 to 8 patients a day instead of 18 to 20, like a routine PCP in the insurance world. So you have a better lifestyle. You're actually probably going to be making a lot more at the end of the day. If you have a full panel, most DPC doctors could take on 500, but they generally stop at 250 or 350 because when they start making about the same money that they were making before and they don't feel like they need any more, they stop taking more patients. So really, and if you wanted to take on all 500, you could pay yourself $300,000, $400,000 a year if you wanted to. And as a PCP, that's great. You guys are in the South. I'm sorry, I'm talking New York numbers. And the average PCP salary up here is low 300s now, maybe high 275, 250, 300 if it's good. I know in the South, it's much higher, more like 300, 350, right, as an average for PCPs. Yeah, you guys are nodding. So anyway, I'm talking probably generalities, but you can pay yourself a good salary as a DPC doctor, have a much better lifestyle, build equity in the business, probably keep a lot more money that you're making because you are the business owner. So yeah, it has the potential of really changing things in medicine in general for women, especially if they're in primary care.
I think you mentioned a lot of really good things about DPC. I think the salary, yes, you're totally right. For those who may not be physicians and are not aware, doctors in the Southeast tend to get paid more than doctors in the Northeast. And the thought process is usually that whenever you are living in a big city, working in a big city, more doctors want to live and work there. And so the employers in those places can pay you less because they've got more doctors that are willing to work in those areas versus in the Southeast, maybe fewer larger cities, and docs tend to make a little bit more. In terms of average salary, I really do think it depends on what kind of PCP you are, or what kind of primary care physician you are, and what model in which you practice. Academics tends to get paid a lot less than those who are in private practice. There is also a growing world, at least in the Southeast, of those who work for nonprofit institutions. And so they're not in academic world, they're not in private practice, but they do work for a nonprofit, large institution, large health system, if you will. And I think it can vary quite a bit. Internal medicine doctors on average might make a little bit more than family medicine, who would make a lot more than pediatrics. So it really just depends on your specialty. I know some docs cruising through, making low 200s in the academic world and loving their life and the flexibility that brings. I also know some primary care doctors, as you mentioned, that are making low to mid 300s and feeling great, and some that are seeing a ton of patients making almost 400,000. So I really do think that it varies a lot. But one of the things that I think I heard you say is that where you were, you felt burned out. You felt like, hey, I was already seeing a lot of patients and already feeling overworked and overburdened for the amount that I was making, and I knew something needed to change. And for you, that change is entrepreneurship through a direct primary care practice. One of the things I hear from other physicians who are interested in direct primary care is, Leisha, I don't know if I could do that, right? I don't know if I have the money saved to be able to take that kind of a risk. I don't know if I have the time to be able to build a practice, go on social media, and then work on the weekends to support my family. Or, Leisha, I don't know the business side of medicine. I just want to be a doctor and I just want to practice medicine and not worry about the other stuff. So there's a lot of limiting beliefs, if you will, that I think hold a lot of doctors back from what they also might feel to be is their life's purpose. What is one belief about money or medicine that you wish more female physicians would challenge?
I wish more female physicians would challenge the belief that they don't want to be involved in the business of medicine or the business of money. I wish more female physicians would stop demonizing money and business in general. In my eyes, money is a tool to create great things, to actually make a change in the world. In my eyes, business is a way to connect people that need something or want something with what I can provide them. Business is a way for me to provide people with the things they want and need. Business is a way for me to build a system where they can continue to get the things they want and need on a routine basis. And business and money is a way I give back to the world. I make the world a better place, right? In an institutional fashion. And in another sense, if I didn't have money, then I couldn't do that. If I didn't have enough money, I couldn't help my community as much because then my hands would be tied. Sure, I would be helping them as a working doctor, but as we've already been over, I just wasn't happy as an insurance-based primary care doctor because it felt like torture. It felt like not a good way to live my life or give service to people around me, to my patients. It didn't feel like a good way to deliver services to my patients. So I wish people would stop demonizing business and money in their head and realize it's a tool.
I agree with you, honey. I think that is so important is that so many physicians think I don't want to be involved in the business side of things. But I wholeheartedly agree with you that being involved in the business side of things can net so many more rewards on the back end. One, you understand how the business operates. So that might provide a few points of clarity of like how you might be being taken advantage of in your current practice and how you might be able to optimize things if you were to start your own. And then it helps you to see, okay, what are the things that I need to pull? What are the levers that I need to press here or there in order to craft my practice how I want? Because I think a lot of people enjoy being physicians. They just don't like having no control over their schedule, or they don't like seeing more patients than they think is good or is sufficient for. Yes, I'm like losing my words here, but you got it. Yes. They're like, okay, I want to spend more time with patients. I want to be able to do this thing or that thing. And so I wholeheartedly agree with you. I think it is amazing. I think there are some people listening that are very interested, either because they might want to become patients of yours, or they are very interested in doing this exact same thing for their own practices. So a few clarifying questions that I get all of the time, so I'm sure you get them as well, is like, if someone were to employ the services of a DPC physician, how do they pay for labs? What happens if they need to see a specialist? You yourself mentioned having to have a surgery. How does that get paid for? So there's a couple of clarifying questions that people are like, help me connect the dots, Leisha. And so if you could help them connect the dots, that would be lovely.
Absolutely. First, I have to caveat by depends on which state you're in because there are different laws. But in New York, how I'm getting the labs, the pre-op labs for my surgery is they're going to go through my regular insurance. I have insurance through my husband. I forgot to mention that as one big deal, one big factor. When people go into DPCs, you got to figure out how you're going to get your own health care, how you're going to get insurance, right? You can buy insurance through the ACA health plans. It's great. It's a huge privilege if your spouse is able to hold down a full-time job with benefits. And so you can just get the benefits through them. But anyway, so I have insurance through my husband. So the labs and imaging are going to go through my insurance. My DPC doctor is going to send them through with the same CPT codes that we do in the insurance world. And my insurance is going to cover it because he's a doctor, even though he's not billing his services through the insurance. The labs and imaging will be covered there. Same thing for specialists. I would use my health insurance for specialists. Unless the specialist is giving direct pay rates. We don't have any specialty DPCs in my area, but I'll use my insurance for that. And same thing for the surgery, obviously. We're going to meet our deductible, And so I'm going to use my insurance for that. The good thing now, because of the new bill, January 1st, 26, my DPC fees, if I want to, I can use my health savings account money to pay my DPC fees. I'd rather not. I can cash flow it and save the receipts and invest that money for later if I need it. I like to use my HSA as a stealth IRA, but you can certainly now use the HSA for the DPC.
All right. I'm sure, like I said, there are some people listening who would love it all. one of the things that we forgot to mention is that you are starting a new podcast. I know in the
right.
past, your podcast, Finding Financial Freedom, has been about medicine and money and how we can grow our wealth and do all of the things, pay down debt. And we know some of those listeners might be a little sad about the fact that you're transitioning, but that's okay. We got Wealth Minded MD, right? They could
That's
come over
right.
and listen to Brittany and I.
Exactly.
We love to talk about medicine and money and all of the nuances, but we wanted to let our audience know about your new podcast. And so I won't take the words out of your mouth. I will give you the floor to kind of make a plug and let us know what it is that you are starting.
I appreciate that. Thank you so much. Yeah, it was such a sad thing to let the Frugal Physician podcast have a break, but I really needed to focus because part of starting a practice is spreading the word, and part of the marketing strategy for my clinic is this podcast. But more than just marketing, it's a way to soothe my conscience because I know I can't take everyone into my clinic and I can only take 500 people, but I wanted to be able to give my community something, even to the people that can't afford to come to my clinic or get a spot in my clinic. So starting a podcast that's patient facing, it's hyper local, but the information could be applicable to really anyone. We're going to be talking to local specialists and covering common health conditions and just going through the health condition in a patient case-based format. So like a fictional patient who develops, say, diabetes, and we talk to the endocrinologist about what's the etiology, how do we treat it, what are some lifestyle modifications we can do. And it's like patient-facing, patient-based information. And hopefully that'll help to educate my community here in upstate New York and Albany and Saratoga about these medical conditions and what they can do to maybe prevent it or what they can expect if they get diagnosed with it and all the different testing that's available in the area. And they can also virtually meet some of the consultants that they might be seeing if they develop these diseases. My biggest deal with physicians and social media, my biggest stick is that we need to get out there and start providing good information because physicians have been so afraid of getting on social media and sharing health information because of the fear of being sued and liability when we do that. Because of that, the internet and TikTok and all the places that are virtually filled with people that don't actually practice medicine, that are giving medical information out, right? Because they have less of a fear of being sued. But really, the experts need to get out there and actually provide good data because God knows, like, we need it today. There's a lot of misinformation out there. So I'm just trying to get some good information out there from people of authority. So the podcast is going to be called 518 Thrives Healthcast. So the 518 Thrives Healthcast. We're on Facebook and Instagram and TikTok at 518 Thrive Health. 518 is our area code. Again, it's marketed towards my local community, but really anyone could benefit from it.
Well, Disha, I want to say I just appreciate all that you have given us today. You've inspired us. You have encouraged us. I mean, the courage, I tell my kids this, is not doing something because of the absence of fear. It's doing it even when you're afraid. And I could hear just from the transparency that you spoke about your own journey of how courageous you have been and continue to be. And how even though some of the naysayers may say that you're not seeing as many patients, you are still anchored in your commitment to serve and served in an optimal way. And that podcast, the 518 Thrives Healthcast, definitely helps you to reach a broader audience and to provide good information to people even outside of your community who might need just to have someone who's compassionate, who knows what they're talking about, to talk about their condition in a way that's digestible and encouraging. So I really appreciate your presence. I'm excited for your journey. Ooh. So people definitely send your patients. I know for me, my patients, I'm like, listen, stop Googling, okay? And I'm like, listen to this podcast instead.
There you go. I love it.
Yes.
Yes. You know what John Mayer says? Fear is a friend that's misunderstood. Often, sometimes fear is survival instinct, but a lot of times fear is actually telling you, hey, maybe take a closer look here. This feels like a stretch, right? This makes me afraid. Oftentimes, fear points towards your next area of growth. This is where you need to grow to.
Yes.
Oftentimes, the best things in our life are on the other side of that fear after you conquer it. And you grow and you become a better person for it, once you get past it. So, take a look, is this fear based in insecurity? Is it based in scarcity? If it is, get past that. You take that head on. You need to get past that if you want to grow as a person. Is this fear based in survival instinct and you might die if you conquer that fear? Well, in that case, stay away. But literally, like, that is my litmus test. Like, okay, if I might actually die if I conquer this fear, then perhaps I'll be okay not trying to conquer it. But if it's based out of like, I feel like I'm not good enough, that I feel like there's something lacking within me, well, then I need to get over it in order to grow.
Yeah, I love that. And just to drop another lyric on us, if it doesn't make you nervous, then it's not worth it, people. So I appreciate the John Mayer quote. And then this one comes from this song called Daydream that I love so much. So thank you for sharing how you had a moment of just sitting and daydreaming and how that is transforming lives, your own and for your patients. So
Thanks.
so happy to have you back on the podcast.
It's been my pleasure. Oh, and I do have to give Jordan Grummett a shout out. It was his book that actually inspired this purpose work. It's Jordan Grummett's Purpose Code. If you're really looking to kind of sit down with yourself, this book will help you ask the right questions to get down to what your life's purpose might really be. Big question. But anyway, that's what I was reading as I was convalescing on the couch and thinking about my life's purpose. So.
This is amazing. And I might have to pick up that book. Brittany knows I love to read, especially if it's transformed your life in this way. I'm still sad to see you transition a little bit away from the financial world, but very, very excited for your new journey. And of course, we'll still be podcasting. So feel free to hop on our Wealth Minded MD podcast and talk to us about money. Me and Brittany are discussing a variety of different topics that we think your audience might find helpful. And hopefully you can lend your opinion as well from time to time. Welcome back. And again, for our audience, if you want something patient facing that your patients might be able to benefit from, please check out her new podcast, 518 Thrives Healthcast. Thanks again, Disha, for joining us.
Oh my gosh, thank you so much. And yeah, we'll be co-airing this on the Frugal Physician as well. So Frugal Physician listeners, guys, I'm sorry I'm not going to be around for just a little bit, but these ladies are amazing. So please give them a follow. And if you are, missing your personal finance hit, this is where you get it. Please listen to Wealth Minded MD. They're great and providing awesome information for physicians out there trying to get their financial lives in order. And thank you, ladies, for having me on again. It's just such a pleasure to talk to you.
Thank you. All right, now it is time for fun money. And Leisha, I want you to go first because I'm still thinking about how I'm spending my money on fun.
Well, I know how I'm spending my money. So I have a friend whose birthday is at the end of March. And usually for her birthday, she likes to plan a trip. And so as we are recording this way before her birthday, we are currently in the stage of trying to figure out where we're going to go. And so last year we went to Costa Rica. That was a super fun trip. And this year we're trying to plan some options that were on the table. Was St. Martin's or maybe the Virgin Islands or maybe Brazil or Belize. And so we're currently in our planning stage trying to figure out how much things cost. Can we find flight deals? She likes Airbnb. I'm a hotel gal, but she likes Airbnb. So she's looking up the Airbnb sites and I'm like, okay, I need to start saving my coins. That's how I am planning to spend my money for fun, is on a birthday trip with one of my closest friends. There's 3 of us. We all went to high school together. We all ran track together. And each year we usually get together and do a girls trip. And so that is currently how I'm spending my time and my money for fun.
Okay, so can I have this itinerary? Because let me tell you, like 3 weeks ago, I was text messaging with 2 of my best friends, and we're trying to find a location, a date for us to celebrate our 40th. And Leisha, I'm like, we should have started this planning 3 years ago because these schedules are not aligning. They're free in September. I'm like, well, school starts in September. And then, I'm free in August. They're like, no, this is a big month for marketing or whatever in their business. So we have not solidified a date. But if I could say, hey, this person has this itinerary, they investigated their points that we could use. We just got to plug and play. Let's get it. So can you please share your itinerary so this could be my fun money?
I actually have an idea for you, which I had brought up to my friend, but I think you might enjoy it, is what about a private villa in Turks and Caicos? I don't know what kind of activities you guys, if you're adventure, if you're whatever, but this is an idea that I had. And you can rent the villa using Hilton points, and you can buy Hilton points too, but it's a private villa, multiple rooms, multiple bathrooms. We know that's important at this stage in our lives. But there's a villa in Turks and Caicos, and there's a spa there. There's lots of amenities. You can rent a boat if you want to. Like, it's a whole thing. And so I thought, I was bringing this up to my friend, like, Turks Turks and Caicos Villa. That would be fun. We did Costa Rica last year, but we went to the adventurous side where the volcano is and the hot springs, and that was really fun. But there's also the beach side. So it really depends on like if you and your friends are looking for a vacation, like rest and relaxation, or if your vacation is more like adventure and trying new things. But I have some ideas. You just got to let me know what you're thinking about.
Okay, I appreciate it. These girls, these ladies, they're all about the soft life.
They want spa treatments and chefs.
Yes,
Okay,
exactly.
got it.
Yep. I think Lauren has a little bit of adventure in her, but maybe just one adventurous activity because I know my other one, she gonna give me all types, so she gonna give me a talking to. You gotta balance the personalities. But yes, please send it over because we have not solidified and it's necessary. Talking about honoring ourselves, filling our cups up. This is one thing that I've been wanting to do, but I haven't done. And I just need to make space for it. But the mental load of doing it can be so taxing that you're like, okay, it's never going to happen. So if you could help me along this journey, much gratitude. So thank you.
All right, what are you buying? What are you spending your money for fun?
I am buying new shoes for my kiddos. As I think about it, I still need to do the research to see if they have these shoes in the adult size. So I went on Kohl's and these Bagley Mishka shoes. And so Brooke was basically scrolling and she's like, oh, these shoes have a B on them. And they came and they are super cute. They're like low tops. They have a little bit of gold and then they have this embroidery bees on them. I was like, oh, these would be fantastic shoes for a mommy. And my wedding shoes are Bagley Mishka. So I was like, oh, this is a great brand. I know that it's durable. So I haven't done the search yet for my size of the shoes, but I think that when I find a down moment, I'm going to purchase me some because I really like how they look on Brooke. So it's like, oh, I should get some for mommy, for myself.
Oh, I love that. So you guys are going to have like matching mommy-daughter shoes. I love it. I love it.
Well, people, we hope that this episode was helpful to you. And please let us know. And let also your patients know about Disha's podcast, 518 Thrive. So anytime your patients are Googling, then this could be a trusted source of information for them instead. And until next time, we can't wait to meet you on the podcast again.
Hello, everybody. It's me, Brooke. I'm recording a little disclaimer for my mommy, Dr. Brittany Halford, and her friend, Dr. Lisa Taylor. Just so you know, they're not financial advisors, tax professionals, lawyers, or financial planners. Everything you hear is for education and entertainment. It's not strict financial advice, you know? So use your best judgment, chat with a tax professional, and all those other people that you need to talk to. Thanks for tuning in today. Keep cruising on your journey to wealth and wellness. Bye-bye.